The risk of infection is something, it's the bane of most surgeons as well as you as a patient. We do our best and utmost to minimize infection with keeping the procedure as clean and sterile as possible, giving you antibiotics before the procedure, making sure you as a patient don't harbor any infection before, during or after the procedure. We do apply special dressings to make sure the wound is watertight, doesn't allow any leakage. The dressings are splash proof, but they're not waterproof in the sense that we would advise you don't immerse yourself in a bath after the procedure for at least 2 weeks, maybe even a little longer. If there's been any strike through the dressing and there's a bit of seepage, you need to come and contact your surgeon or your GP. But by and large, do your best to avoid infection. Once you've had a shower, pat it dry, maybe even use a hair dryer so that you keep the moisture to a bare minimum.
And on that matter, almost all knees look inflamed after surgery. So I would not recommend you to have oral antibiotics if there is a cause for concern. I would like, I'm sure you do the same thing, Mr. Jacob. I would like to see my knee replacement, even if it's a superficial infection, and then decide whether to give antibiotics or
Absolutely.
not. Because in majority of cases, what is perceived as an infection is just an inflammation around the knee. You could appreciate that you're putting this big thing into your knee. Your knee will be swollen. Your knee will have an inflammation. So that is not an infection. But if an infection is where you feel unwell in yourself, and as Mr. Jacob said, if you feel unwell in yourself, you will have to present yourself to A&E. Now, Mr. Jacob, what do you think about the range of movement? What are you expecting when a post-knee replacement patient comes to see you at 6 weeks?
So during the procedure, when you're asleep as a patient, if you've had a knee replacement or if your relative has had a knee replacement, we do our best to keep the knee moved from 0 degrees, which is fully straight, to at least 120 degrees. So if that is straight on the side, I want it to be bent to at least 120, that's 90. And that's what I expect after the procedure, but that's a wishful dream. Most of my patients will try and get past the 90-degree mark, which is what our physiotherapists encourage. But anything over 120 degrees is definitely a bonus. Try and keep the knee moving and listen to your physiotherapist. I often call them physioterrorists, not physiotherapists, because they will whip you and encourage you to move, and it's only for your benefit.
I think, as previously said, it is a race between scar tissue formation and your muscles getting activated. If in the early stages, if your knee is not moving, feel free to go back and see your surgeon, and myself or Mr. Jacob or any other surgeon who has done this knee replacement. We're more than happy to see you and deal with the situation. Now, Mr. Jacob, what do you think when would you advise the other side to be done, considering that they would have had arthritis on the other side, obviously?
As a rule of thumb, if the patient comes requesting for the other side, I would take it as a tacit compliment that the first side had worked.
Sure.
And they've done the homework. And
they like you.
Right.
Okay.
And as a result of that, then the next side would be perhaps a way of getting forward and getting moving with the knee replacement. But remember, no two sides are the same. You might have the same surgeon, you might have the same implant, and you might have a different day and the same type of procedure done, and they will never likely function the same. And although both the legs belong to you, they will perform differently, and just keep that expectation as open as possible, and we will try and get the best output as a result of the replacement.
So from a time frame, what would you say it is?
I would say roughly for your body to recoup and refresh itself and be rejuvenated from the first anesthetic, I space it anything between 6 months to 9 months.
Okay.
From the do you do anything different?
I sometimes, if the patients are quite fit and well, I would say 3 months, based on individual patients. Now, on that question, would you be happy to do both sides at the same time?
So I pick my patients very carefully. Patients who are very ultra fit, I would offer them that chance. There is a slightly increased risk of complications, particularly showers of embolism that can go into your lungs. So I don't think patients, once they are fully aware of the risk and complications would unnecessarily predispose themselves to having both the knees done together.
Okay.
Although theoretically it is a good concept, I'd rather keep safety as the priority.
Sure.
And encourage them to have it at least 6 months apart.
Sure.
So I think that's it from the post-operative status of your knee replacement. We've gone through the ins and outs of the procedure as well as the risk and complications. Thank you for tuning with us, and be sure to visit us again.
And remember, your health is your responsibility. Thank you once again.
Thank you.